need to refer on anything. So therefore, Your Excellency, allow me therefore to say that we have a few, just some quick brief presentations that we request that you allow. Anne was the one in charge of community health services, was making a presentation, and I want to request her, I'll give her 5 minutes, just to tell us just some quick highlights on the CHP job aid. Then after that, we are going to have the primary healthcare coordinator, who is going to also give us some key highlights. You may not necessarily present this through PowerPoint. I just want you to, because this is a document that you understand, to just tell His Excellency in a brief, what is it that the CHPs expect in this document. So, tumkaribisha.
Thank you very much to our chief guest today, His Excellency our Governor, Deputy Governor, our Chief Officer, the CEC Nakuru, the Amref County Director, or Protocol Officer. I take this opportunity to give an overview of the CHP guidelines. Currently, our Governor, we have 2460 CHPs. We have a shortage because of the exit rate of our CHPs. We are losing a lot of CHPs because of NCDs. We feel that it is good that we capacity build our CHPs so that when they go to the household, they are going to be able to give services that are equal. This guide is going to help us to give quality and standardized messaging. A CHP in Kenya, a CHP in Okorowene, a CHP in Teto will pass the same message in all the household. We have also tried to give them a guide on what to do when they go to the household. The referral. We know that we have not been doing very well when it comes to the referral because it was not connected. The CHPs, they are using the HS. The message remains in the phone. When they send a client to the RIC facility, the RIC facility is not able to see what the CHP referred that the patient or that client for. Currently, the ECHS, through the ministry, they have launched a new version, 3.0. So our CHPs will be able now to refer using their phone to the RIC facility direct. So the guide is going to be of help to them, a lot of help to them, so that as they give the services, they will improve with the quality of services they are giving, and we have a healthy, wealthy Nyeri County that we can now invest on others. We can now take the money from the curative to the other investment, and our county can grow. I think with that, I return the mic to our director, and I say that I also take this forum that have been given to tell our governor that we are grateful as community health workers. We are grateful as CHPs. We are even wondering, unatuachia nani, but I've been visiting our deputy governor more often. Lakini tunamwambia our DG, our dad has taken care of us very well. We have been spoiled. We are the county that has been paid stipend every month. We are the county that has 100% kitted CHP in Kenya. We are the county that has, through the governor, through the COG, he was able to lobby for us. We are paid on time even by the national government. So, Bwana DG, kibarua iko kwako. As that has taken care of us, now that you are coming and we are wishing you the best, we hope that our stipend will be paid on time. You will continue spoiling us, paying us on time. And ukiangalia zile departments zingine, our governor is able to lobby for us. We have gotten the chickens, we have gotten the, currently nilisikia jana tunapatiwa meko. So we hope that as you come to wear those shoes, just know that those shoes are already big and you need to do things so that you can fit unto them. Thank you very much.
So thank you very much, and for that brief, and as well as those people, once you give them a mic, they never waste that opportunity. That is done for you. Yes. So, Your Excellency, I want now to go to the next stage. And we have part of this. I know we have given you a quick brief on the document, but I want to request the coordinator who does coordination on matters of primary health care, that is Mr. Patrick Mbugwa, to also take 5 minutes to just give some key highlights, some high-level highlights in regards to what is contained in that strategy. Patrick.
His Excellency, our Governor, His Excellency, our Deputy Governor, the CEC present, our partners, our friends, CC from Nakuru. Good morning, everyone. Yes, I want to take this opportunity to thank our Governor, just like what Anne has said, for giving us that opportunity to interact very well in the Department of Health. And when we look at this strategy, I want us to go a certain journey. Just think of that mother at a small village in Kenya West, a place like Katanga. Look at that mother at 10 or at 5 a.m. The child gets convulsions and fever. What happens to that? Number one, we are saying primary health care, it is starting from the community. And it is at that level that this child will be taken to a CHP, who will link that baby and the mother to a dispensary or a health center. If at all that child will require referral, will be taken to level 4, that is the hub. That is the journey that we are having in our PCN strategy. Because we want a scenario whereby we will not have a gap, a crack, whereby this child or this pregnant mother who has fainted will be lost. And that is the journey that we are in when we talk of these primary health care networks. So, by doing this, we are looking at community, the dispensary, the health center, the referral facility, and back to them, and back to the community. And at every point along the journey, who is responsible? At that level, we have the CHP, just like what Anne has said. At the primary health care facilities, we have qualified health care workers whom the governor has actually been paying their salaries on time, and if at all it will be late, he communicates to us. True or false? Yes, it is communicated. And have been promoted, have been given opportunity to go to school, just like what we had Dr. Rolin talk about. So in this document, having gone through the journey, having done the basic analysis of what we did in the baseline assessment, we actually came up with the needs of our community. And out of those needs, we prioritized what we did. Remember, we are having the double burden, communicable diseases and non-communicable diseases. And we are talking of the mental health, which is there. And Kamau is here and is very passionate about it. Therefore, when we talk of this strategy, it is giving us a roadmap, a direction. Where are we? Where do we want to go? And we have incorporated every person who is in this board, the patient, partners, the healthcare workers, and it is linked to the national level because all our reports are to be submitted to the national level so that we can use data for decision making. And therefore, when we think of this strategy, we are thinking of one patient, one journey, and one connected health system. Thank you so much.
Thank you, Your Excellency. Thank you, Your Excellency, for once again being here and giving us your time. Let's appreciate Patrick. Your Excellency, the CHP job it. We felt as a department that even the doctors who are in hospitals, they usually carry something in their pocket because from time to time they need to refer. And that's why when we approached them, Health Africa, they were kind enough to agree that we need also to come up with something that the CHPs can put in their pockets. And from time to time, they can also refer. So we therefore want to say that this is a document that should have happened a long time ago. Your Excellency, in this journey, as Patrick has rightly said, is a journey that starts all the way from the household. This is a document that we started implementing in 2024, although we are launching it today. And there are certain people that have benefited from that journey. I therefore, with your permission, Your Excellency, would like to request just some 2 people who have been in this journey so that you can also hear from the community their testimonies. And the first person to come and tell us what has been the experience as we implement this document is Margaret. Margaret. Yes, tumkaribisha Margaret. So Margaret, ile lugha tutasikia ukiwa sawa nayo. Kuja hapa Margaret. Haya. Endelea Margaret. Ile tu lugha utasikia uko sawa nayo. Ndio. Hata kigumu sawa.
No mwire turia wanyitekanire festival etagwo English nyamuna agĩthiĩ agĩta Julie ũrĩa ũkoragwo hau Gaigũ dispensary agĩthiĩ akĩmũria Margaret rĩ ũmũthondekaga kũ anjĩraga nĩ gĩthũri akanjĩra nĩ homa o mweri ndathiaga maita merĩ o hithĩte thĩna wakwa rĩu Madam Winnie niwe wandĩkire marũa akĩandĩka marũa njoke Nyeri provincial General Hospital mweri 14 ngatindi o ĩyo Winnie ahũrĩra mũirĩtu wakwa thimũ akĩmwĩra ũke gũkũ Gaikũyũ mamigwo nĩ twamuona twacemania na mũirĩtu wakwa ngĩmũria wajĩ gũthondekwo nawe akĩnjĩra ĩĩ wajĩ gũthondekwo kũ nĩngũka gũkwĩra ngĩrigwo mũirĩtu na ndauma mũrwaru nauma wĩra rĩ hau atĩa noguo kumbe magũka na ndagĩtarĩ o ũrĩa o mũciĩ kĩamba magĩikara thĩ makĩamba makĩaria tũgĩcoka tũgĩtwo na mũkũrũ nyina mũthuri tũkĩingĩra nyũmba akiuga haha ndiuma mwarĩ haca tũkĩrorana na ciana ciakwa na mũkũrũ twarorana akĩũria rĩu rĩ China no nginya ĩgatwo tondũ rũciũ arendekana Nyeri provincial General Hospital nĩkĩ ndarĩ akwĩra kũrĩa arwarĩte mwarĩgu acha ti kwega hau ngĩambĩrĩria kũrĩa rĩrĩa ndaiguire era mũkũrũ ti kwega Madam Winnie teithagio nĩ Ngai harĩa ũrĩ aya makĩrwo nĩ ũcio we mũgwĩka ũguo o kũrĩa mũndũ arutaga wĩra mũndũ athiagĩre ngiri niĩ nani nĩ kũruta ngiri cia thate tu niĩ ndĩhaga ngiri 4 cia thate tu ĩgĩcagwo Winnie akĩra mũirĩtu o ũcio ũkũrugamĩte unit tũrathiĩ nawe ũkarĩhe SHA tondũ augĩte oneaga kũrĩhĩka akũrara kũruta mbeca cioneke rĩrĩa cionekire magĩthiĩ makĩrĩha hau nĩtwerire Ngai ĩna Ngai ũyũ wa ciama nĩwatũgitĩra kĩama mbeca cioneka nake airĩtu aya mathiĩ o kũrĩa mũndũ arutaga wĩra gũtirĩ mũndũ wacokagia kĩmamiko nĩ mũrwaru kũna tuma nake Gaikũyũ nĩ mũrwaru nerwo rũciũ no nginya gathiĩ Nyeri General agathondekwo kũ nĩtũgoka gũkwĩra twauma kuo haya the following day Winnie akiuga thaa igĩrĩ tũgakorwo General Nyeri thaa igĩrĩ tũkĩiba tigiti nĩ kũrĩ o mũkũrũ wa ũrĩa rĩ agĩcoka ona nyũmba agĩthiĩ akĩrehe ngiri nĩgetha tũthiĩ tũgagĩthondekwo Nyeri niĩ rĩrĩa ndonire Winnie twakinya Nyeri mweri 14 agaciraciria niĩ nĩ kũmaka ndamakire ndonire Ngai ndagĩtarĩ wa gũtuma thutha nginya o kũrĩa guothe tũrĩgĩthiĩ thengiũ mwathani noguo Winnie akĩoya maratathi marĩa twandĩkĩirwo Gaikũyũ akĩingĩra namo ngĩtwo tũkĩrũmanĩrĩra na mũirĩtu tũgĩthiĩ agĩtũtwara kũrĩa atũtwarire agĩtwĩra tũngĩthĩa rĩ inyuĩ nĩ mũgũthondekwo nĩndanengera ndagĩtarĩ marũa maku ngĩmwĩra thengiũ rathimwo mũno haya haha nĩho hakĩrĩ haritũ ngĩingĩra ngĩtwo ngĩingĩra kũingĩra ngĩrwo ngĩrute nguo ndikũmũconoria ithuothe ngĩrwo ngĩrute nguo ngĩruta nguo mũirĩtu agĩtwo akĩrwo nĩwe mami gũkũ nĩ arwarĩte ndagaranjĩra gĩũke wone maina mũirĩtu kazini yake makĩingĩra makĩkĩonio kũrĩa ndwarĩte ciana ciarera ngĩrigwo rĩu gũkũ rĩ gũgũthiĩ atĩa ndarĩkia gũthondekwo tondũ handũ haha ti hahũthũ ngĩthondekwo nĩ Dr. Macharia ndagĩtarĩ wetagwo Dr. Macharia ngĩingĩra aya makĩrwaga makagũre sijui cindano magĩthiĩ makĩgũra cindano magĩũka Rĩrĩa ndonire ndagĩtarĩ nacio akĩgicĩria ngĩmaka, ngĩona haha nĩ gĩkuũ kĩrĩho. No ngĩra Ngai tondũ tũraga muoyo, nĩndaregana na gĩkuũ. Haya, noguo, tũgĩthiĩ, makĩgoma kagũre container, ga gũgĩkĩra sample ici, magĩthiĩ. Rĩu nĩ kũrutĩrwo wĩra. Ngĩra Dr. Macenge ndakũhoya o ihoya rĩmwe niĩ ndũkahe gĩtanda. Akĩnjũria nĩkĩ? Harĩ wĩra mũritũ ũrĩ mbere yakwa. Na tondũ harĩ kairĩtu kabacĩte gakanjigĩra twana tũtatũ rĩ, ngĩrigwo atĩrĩ, ndingĩkoma rĩ, twana tũtũ rĩ, tũrĩtaga hau. Nake Ngai akĩigua ihoya rĩakwa. Gĩthondekwo. Sample ikĩrwo igũtwarwo Agakani. Igĩtwarwo Agakani ta mweri mũgima. Wini o ũrĩa twambanĩrĩire nake Gaitũĩ ahũraga ũthio akahũra mũirĩtu ũrĩa Eunice. Kĩrĩa resort nĩ yaumire. Kamwĩra aca. Eterera nĩngakwĩra yauma. Rĩrĩa yakiumire nĩ yaumire ta mweri mũgima ũgĩthira. Gũkĩhũrwo thimũ mũirĩtu ũrĩa akĩhũrĩrwo thimũ akĩrwo resort nĩ gokire tũke Nyeri, tũgĩũka Nyeri. Tũneo sample tũgĩthiĩ o Njeri. Hau nĩho ndambĩrĩria process ya gũthondekwo ũguo. No ciana nĩ ciarĩraga mũno ikajũria cũcũ. No ũkahona? Kwa hinya wa Ngai. Na niĩ ngĩtĩkĩra ngiuga ta ũyũ mũrimũ nĩ ngũtoria. Ndera Ngai nĩ ngũtoria. Niĩ ngĩambĩrĩria gũkĩrwo January gũtirĩ na kĩmo. Nĩ twathire Mathari. Ngĩambĩrĩria kĩmo. Na kĩmo ti hahũthũ. Ũguo andũ meciragia ti hahũthũ, kĩmo ti hũthũ. Nĩndathire kĩmo 8. Na ndarĩkia ndĩciria. Rĩu ngĩkĩambĩrĩria tũgĩtwarana. SHA no ĩrakĩruta wĩra. Na mũtikae gũkerwo atĩ SHA ndĩraruta wĩra. SHA mũndũ ũtagatĩte ma ndamũhoya ihoya timu atĩ SHA. Niĩ ũrĩa ĩndwarĩte hau nginyĩte tondũ ndekire nginya harambĩ. Na harambĩ hĩndĩ ĩyo gĩtiribũ-inĩ kĩu kĩrakĩrĩ mbeca no ndakĩonire tũbeca tũnini. SHA ĩraruta wĩra kama kawaida. Gavana witũ SHA nĩ ĩraruta wĩra. Na nĩ gũtirĩ mũndũ ũngĩnjiguire SHA ndĩraruta wĩra. SHA nĩ ĩraruta wĩra. Tondũ kũrĩ hĩndĩ thiaga ngarĩhĩrwo 58,000 rita rĩmwe. No nĩ tũgĩthiaga na mbeca ona gũtuĩka ũhinyĩrĩrĩku wa mbeca gũtirĩ na mbia gũkĩaria. Nĩ tũthiaga na kaci ya 21. Gũkĩrabu mbica ũguo icio itirĩhagwo nĩ SHA. No ũrĩa kũngĩ kĩmondo ndawa ici ciothe icio SHA nĩ ĩrĩhaga. No ici ingĩ ici tũrarĩ na 21 icio gũtirĩ, icio nĩ inyuĩ mũkũrĩha kaci, mũkũrĩha na thimũ. Haya, isitoshe oho tũrĩ o hau tigiti tũtirĩ. Mwana wakwa akanjũria mami kũrĩ mũndũ ũngĩgũteithia na tigiti. Mũmwena ngawe ũkenga igũrũ igũrũ. Tũgĩkinya hwaĩ-inĩ tũkeoka gũgĩthiĩ rũciũ rĩ, mbeca nĩ ikuoneka. Ũkona mũsamaria mwema aumĩte na kũruta akamũrehere mbeca. Ile kũu tũkũgocithia Ngai.
Thank you. Wacha tumpigie makofi Margaret. Thank you Margaret. Nafikiria kwa sababu ya wakati. Have you had CEO ndio PCN? Yes. Your Excellency. Asante, tumpigie tena makofi ya kirudi kwa sisi. Makofi mpaka sisi. That is a powerful what you have just described, that is what PCN is all about. You see that journey all the way from the community. What Patrick was describing now in more technical terms, he has just broken down that story. So all the way from the community, whatever happened to the community until she got to level 5 facility. So that is all what PCN is all about. And I think the other bit that she has also really reiterated is the fact that SHA is working. Especially for inpatient, for cancer patients, they are benefiting a lot from SHA. Of course, there are two sides to it, Your Excellency. There is a bit of the patient, but there is also the bit or a bit whereby we give the service, the patient is happy, but we don't get the money, or the money is delayed. Your Excellency, allow me, because these are your people, and it's good when you hear it from the community. Allow me to also invite Francis Gishoki to also come and say something. Is Francis in the house? Yes, Francis. Karibu sana. Then after that, we'll have Kafada, a CHP, and then we'll be done with that session. Tumkaribishe Francis. So Francis, tutakupea dakika 5. Karibu.
Shukran, His Excellency, our Governor, His Deputy, AMLEF, na wasalimia kwa wote. This is my story where I got an accident on 2019. Nilipata ajali, nikagongwa mguu. Kugongwa mguu, kisha nikapata shida ya brada. Kupata shida ya brada, niliadmitiwa hospitali kwa sababu ya mguu. Nikakaa hospitali hapa PGH for 6 weeks. 6 weeks zikaisha nikivutwa na traction, na ambapo niliambiwa nitaenda nyumbani. Nikapewa ruhusa, but sikutengeneza shida ya catheter. Hapo nikaenda nyumbani, COVID ikakuja. Nilikuwa narudi for after 2 weeks naenda nabadilishwa catheter. After 2 weeks naenda nabadilishwa catheter. Alafu corona ikakuja, clinic zikapotea. Kupoteza clinic, hapo ndipo nilianza kukua sasa desperate. Nikapata ambapo nilizunguka sana. Nikakuwa nikipata shida kujikonjolea, nikinuka kwa mkojo kila siku, kila saa. Na mzazi hakuwa na pesa ya kwenda kwa hospitali nyingine ndio nipate hizo clinic back. UHC mmoja wa kwetu, CHP wa kwetu mmoja akaniona, akaniuliza mbona siendagi clinic. Nikamwambia mimi nilipoteza kliniki zangu. Akaniambia sasa unaweza taka kuenda hosi. Nikamwambia Ndo hapo nikasikia scorecard ya AMLEF, akaniambia niende mkutano, na nikaenda huko mkutano. Kwenda mkutano, AMLEF wakakuja. AMLEF wakikuja, ndo mkutano ikiisha, wakanotice Madam Deborah akanotice nilikuwa najikojolea kwa trouser. Nilikuwa wet kwa trouser. Madam Deborah akaniita, akaniuliza shida yangu. Nikamwambia mimi niko na shida ya catheter. Madam Deborah akaniambia niende documents zangu nyumbani. Na hapo nikaendea documents zangu nyumbani. Wakaongea na CHPs. Hapo CHPs wakaambiwa walilipie SHA. Ambapo walichanga pesa zao kutoka kwa mfuko, wakanilipia SHA. 9,000 mwaka mzima. Wakanilipia SHA, alafu AMREF wakachukulia. Madam Debola akani connect na urologist level 6 ambaye anaitwa Dr. Kiga. Hapo tukaenda, bado walikuja hiyo siku na tukaingia na wao huko kwa Dr. Kiga. Dr. Kiga akaniambia nataka X-ray. X-ray ilikuwa 4,500. AMREF tena wakani hizo pesa ndo walinitumia 4,000 ya kwenda hospital. Hapo nikaenda X-ray. Kwenda X-ray nikaambiwa niko na shida ya bladder na kuna mfupa ilikuwa imevunjika. Kwenda kurudisha results, daktari aliniambia nataka surgery. Mimi kuniambia nataka surgery, mimi nilikuwa tu nikasema ni sawa, nikaenda nyumbani. Ambapo nilisikia nataka surgery, mimi nikasema huko sitarudi tena. Nilikuwa lose hope kabisa. Nikasema mimi huko sitarudi tena. Tunasikianga watu wakienda dieta huwa amuki. Mimi sasa Debola ananipigia simu ananiuliza, Moko Francis, ulienda clinic? Namwambia lakini wapi? Mimi sijaenda clinic. Nilifika Ulaya na rudi. Hivyo AMREF wakanifuatilia kabisa. Wakanisukuma CHP wa kwetu wakasukuma kabisa. Ale CHP wa kwetu ambapo walikuja wakagombana na babangu. Juu babangu AMREF alinisukuma kabisa hadi nikaitikia kufanyiwa surgery. Nikapewa booking on 28 mwezi wa 5. 29 nikafanyiwa surgery and it was successful. Hadi wa leo saa hii niko sawa. Naweza shukuru tu mahali walipo. Naweza washukuru tu sana na CHPs. Naweza washukuru tu sana. Kama si wao, mimi ningekuwa tu maiti. Juu nilikuwa tu nimepoteza mwelekeo.
Thank you. I think let's appreciate Francis.
Bora pahali ulipo, Mungu akubariki sana na AMREF team continue na hiyo heart na kusaidia watu wasiojiweza. Asanteni sana.
Thank you.
Yes, Gavana, nimekusalimia sana.
Let's appreciate His Excellency.
Thank you, Francis. Your Excellency,
like hearing it from the ground. At times, it's good when you hear it from the beneficiaries of these partnerships. You remember in the first story, there was a lot of mention of a certain Winnie. It's also good we appreciate the people who've been mentioned in this story. Where is Winnie? Yes, let's appreciate Winnie. Because, you know, it's good, the Excellency, I believe in giving people flowers when they can see them, when they can feel them, when they can smell them. Thank you, Winnie. Let's appreciate Deborah. Deborah has also been mentioned. Yes, and in the two journeys, of course, there are CHPs who have been mentioned. I don't know whether those CHPs are here. Can they stand if they are here? I know they have not been mentioned by name, but they also played a key role in ensuring that these two clients are linked to care. Are they in the house? Let's then appreciate all the CHPs in the house. Your Excellency, I think it would be unfair for us to conclude this session without hearing from your Madaktari wa Mashinani. So with your permission, allow me to invite Kafada to speak on behalf of CHPs and specifically to tell us what is it that he feels will be the advantage of having a pocket guide and what are some of the challenges in regards to this. I know he might get into many, but let's focus on the pocket guide.
Yes, His Excellency the Governor, the Deputy Governor, the Chair of the Committee, the CEC's President, all those involved in now the health sector, including now the CHPs. They said good afternoon or good evening. Oh, it's morning. Oh, thank you. Good morning, all. Yes, thank you very much. I'm here now to start with thanking the AMREF Africa, and this is through the project Thrive. But before that, I want just to start with a phrase which says that we start strong, but we finish strong. We start strong, but we finish strong. It's with reference with the genesis of stories of CHPs. Currently we are CHPs, but we started as Thank you. Community Health Frontiers, CHPs, then we are CHPs now. Currently, isn't it? That was the journey. That is, we started strong, and now we are finishing strong. Because everybody, now all the success stories which have been mentioned, there is always a reference of the CHPs in the query. Yes, on behalf of the CHPs, I would like to sincerely thank AMREF through the Project Drive for their continued support, training and facilitation of CHPs, support of health facilities, providing health messages, that is now the IEC materials, and the support of staff. Those skills that have been given to us has made us to improve in our roles, our role in the community interactions, and improve in the home visit for health and watch services in the community. We are especially grateful for the Project Drive continued efforts to support and facilitate all those who are vulnerable in our community, ensuring that everyone is included and empowered. This commitment to inclusivity is truly commendable. We also appreciate the introduction of the dialogue days. These forums provide an important opportunity for open communication, sharing ideas, addressing challenges, and finding practical solutions together. We encourage that dialogue days continue and expand to cover other issues that are important to us as employees and stakeholders. Also, AMREF made us to start now the WIT, that is working improvement teams, also to have the scorecard, which also includes the community, and through the enriches or enriches in our community or the health facilities. As we look ahead, we would like to recommend that greater attention be given to mental wellness. Mental health is a critical aspect of overall well-being and workplace productivity. We propose that every unit identifies and help connect colleagues to appropriate services, such as initiatives could play a significant role in reducing cases of suicide. Several gender-based violence, that is sexual, gender-based violence, and other mental health challenges. On facilitation, please. The member and consider the economic crisis. Once again, thank you, AMREF, through this project or drive, for your declaration, dedication, partnership, and investment in our growth, health. We look forward to continued collaboration and more impactful initiatives in the future. CHP's job aid, now which you have facilitated all in all the process, and now we have now the job aid to help guide. That is now to give us or help us to manage or to be defining for those health messages. With that, we say thanks very much to AMREF for the 3 years that we have been partnering. Now, in total conclusion of that I have dearly talked of the CHP and also now the AMREF. I want now to shift to our Chinese language, because what I'm now going to address is not for them, again, it's just meant for the people. You get here, Governor, to put a shock Yagano, the look at the graphic and to put your authority. We took our head to CHP, CHV, a deal to a CHW, and to create CHP. We can get to what the to Cuba, we head the Tokyo way in Italy. From the talk in Ira to Ahayabo, to carry a woman and a matata or a matata. We head the CHP from the toilet. And HIF up to date, not only to have a base in hand, and enjoy your hard work. There are the and if you are CHP, no, you to here. And working by teach you better to okay, come up to have 2,500 out of the 2,500. Okay, can you have which is the banana, and the people go to show. Greater County, or the Rocky South. And they got out of your honey out, one of them got really. They were killed at CHP, whatever it's than the community, or ever see a cute more than. They can go to meet a name who got the city of Guanana, Kanichi, the Matano, the Buganaki. Gaba, that's Yakuda told the neighbor to run in Bangladesh, they are capable of being at the si a poussé de la KZB, si on a été sur le train ghetto, mais c'est bien il faut retrouver comme les civils qui parlent à mer, la train comme les civils qui parlent à moi, allez qui non si on casse la nature dans le tout pour la toute dire d'ailleurs il y a des gens comme les bon pour les autres pour kilo kwa kwa kutika kanina hivi muganda na kia ke woka kawadi nabe kongo ke da police in fact ako kula ni indicate je draw that picture in the stupid or whatever you are. I will show you. Ori okay. Na ndela kwa hadi video services. Ndio tu bila buchi tija kwa machine. Ohora wa kombo ni tisi to leo time. Kwa ba ubaiki mo na mafaka na ile community. Na ya buchi kwa kwa kuisha kwa ni. Ora sio kwa niki. Kwa ndo kwa ni mgenda kwa mtu BP ile. Mtu ni you aunt, ni you mom, ni you relative toto. To ya ndo community na ya ndo yetu. We para ni kwa da ile. We do that. Ndio kuchokia dado ile forum. Na mundu wothe ungiuga hita ndauga umri no tumegia ati ingine kuri mental illness na ni bara aliye kwa ni zakati kurale mudora kurale hale kwa ni no je ta kuzalika atuo the twat kwa mental health mental wellness no likadimu no tige kwario ugietha kwa biashara wego ugietha kwa uhoni thĩinĩ wa community ndarĩ thĩinĩ wa njukua ĩrĩa yekaga ũhoro wa mental wellness kana kũrora thĩna wa meci nĩ twakorire mwanake warĩ na mũkanda arehetwo nĩ andũ aigana warĩ mũhuko ũcio no kĩndũ gĩkorĩ documented o ndikwĩra nũ tondũ thĩinĩ wa kaci ndũheanaga ndeto kĩ no thutha wa kwaria mwanake ũyũ warutire mũkanda na akĩũhikia kĩo Are we together? Yes. Ogwe kwa kondo ngemune muthenya ũcio nĩ kwahonokirio mũndũ maũndũ marĩa mothe mekĩkire mũthenya ũcio nĩ maritũ koguo ndĩrenda kuga atĩ ũhoro wa mental wellness na nĩguo ndagera kwaria atĩrĩrĩ o every unit kũngĩhotekeka nĩ gũthomithio mũndũ ũmwe out of the 10 kana kuongererwo mũndũ ũkũmenya maũndũ ma mathĩna ma meciria.
Thank you. Tupigie kabala makofi. No, Your Excellency, you are madaktari mashinani. No, they wear many caps. So, yes, so and also I think they've been taught by their leader every time they get at the mic, they don't lose that opportunity. I think Your Excellency, all in all, it's that opportunity when they get to see their father, so it's an opportunity to say everything. So Your Excellency, once again, thank you for your time. We have now come to the end of that session. You've heard from the beneficiaries. You've heard that you've had a very, very fruitful partnership with AMREF Health Africa. We really want to appreciate that support. Dr. Meshak, we have, I always say in Nyeri we don't have many partners, but AMREF has really come in handy. So we then want to say asante sana. Having said that, Your Excellency, allow me now to invite Waziri, Dr. Joseph Kirago, to take over from there so that then he can go ahead and invite the next speaker. So mkaribisha Waziri kwa makofi.
Thank you so much, Director. Kindly let us appreciate the Director. Done a wonderful job. Your Excellency, our Governor, Your Excellency, the Deputy Governor, Madam Gaita, who is the Chair of the Health Services Fund, our guest here, Dr. Meshak, who is the Country Director of AMREF, my colleagues and fellow participants. I wish to take this opportunity to welcome you all for this function, which is a function of its own kind, not only in the country, but also in the country. I wish to recognize also our CEC, my colleague from Nakuru, Madam Loselin Mugai, karibu sana. Allow me to first invite our Country Director, AMREF, Dr. Meshak Dlango, to give his remarks.
Your Excellency, Mwalimu Mutahi Kahiga, EGH, and Governor of Nyeri County, first of all, thank you for giving your people the freedom to speak and to give you feedback. Yeah? Thank you very much. The Deputy Governor, Wanoi Nyeri, Dr. Joseph Kirago, County Executive Committee Member of Medical Services and Public Health, Nyeri County, Madam Rosie Mugai, our friend from Nakuru, where we also have the Modana project. We're an amazing work there, and a lot of learning happening between the two counties, sister counties. Ambassador Joseph Gaita, it's a pleasure to meet you today. And all the representatives from the Ministry of Health, county government, health workers, and community health workers, promoters here, who are our champions, distinguished guests, ladies and gentlemen, no protocols observed. Good morning. Good morning. It is 2 minutes before afternoon. For AMREF, it's truly an honor to join you for the launch of the Nyeri County Primary Healthcare Network Strategy and the Community Health Promoters Job Aid Booklet. These are two documents that have got one purpose: to build good care that is connected, that is built around the people or people-centered and closer to the household. As you know, Nyeri is home, where I also come from. Nyeri is home to almost 850,000 people, living in almost 250,000 households. And to serve them, the strategy, the primary healthcare strategy, creates 8 primary care networks, one in each sub-county. And each network is anchored on a sub-county hospital and links the health centers, the dispensaries, and the communities around it. And I think we have heard the stories from Margaret Francis demonstrating how that connection works. It brings the counties, 1,607 health workers into one team, so that a family in Kieni or a family in Tetu, where I come from, is as connected to care as a family here in town. And the aim, our aim in all this, working together as a county, is to ensure that the right care is getting to the, we are receiving the right care at the right place at the right time. And I think the example Madam Margaret gave is a reminder of what that means. That story, and Francis, that story, you can never forget it. It's a reminder of why we are all here. And we are all the same. We are all human. We all go through these challenges in different forms, and we are building a system that truly serves us as a people. That network of health workforce starts on a base this county has built very well. 251 community health units served by 2,510 community health promoters. And as community health promoters, you are the first link between a family and a health system, and you have heard that. Your county has recognized that in law through the Community Health Services Act of 2024. You have registered thousands of households, as we have seen in the ECHIS system, and you share this information. You do the screening. We have seen all the screenings you have done, even in the National Data System, ECHIS, and you are watching how diseases are happening among communities, and you are doing referrals. And for that, as AMREF South Africa, we truly thank you. We truly appreciate you as community health promoters. Your Excellency, let me thank you and the county health management team for ensuring that these community health promoters are well supported. As a county, you have done your part to make sure that they are getting their stipends, as the national government does its part, and also ensuring they are well kitted and all that. And it shows in the results, because Nyeri County is an exemplar in many areas. You get awards in many areas. You're leaders for it. You're the best county with the lowest maternal deaths. In Kenya, Nyeri County has the fewest number of mothers dying when giving birth. And that is because of your work, the way you work to households. You ensure the women have birth preparedness plans. Every mother knows where they will deliver, and when they go to the hospital, they find a consultant ready to work with them. Thank you, Governor, and the County Health Management team, because you have also learned that if community health workers refer the people, but they don't find the right expertise, then women go to die in hospitals. That is not happening in Nyeri. They are referred and they go to hospitals and they leave and they walk away with their babies very happy. Please, Makofi Kwa. We're doing very, very well. We are very happy and we are running from this county, and we are bringing others to learn. As we present on the studies we have done, we are really telling that story. Now, turning to the job aid booklet that we are launching today. The job aid booklet puts clear guidance and reference in the hands of these community health promoters. It has 16 topics, from the health of mothers and children to high blood pressure to diabetes, community surveillance, and referrals. And I want to believe it has mental health. Does it? Yes. Thank you. Thank God it has mental health. With it, every community health promoter gives the same correct message
No one has to hold every detail in their head. It helps you spot danger, signs, and refer the person to the right care. And this is important because myself, I'm a medical doctor. I practiced in Nakuru for 1 year, then went and practiced in Lodwar for about 4 years. And even when I was practicing, I would talk to the client and I would remember there's this medicine I need to give, but I cannot remember the dose. So there's a booklet, we call it LIMS. Those who are medical doctors, you know it. It was always in my desk. I would get it, look at it, make sure I'm giving the right dose so that I don't give a very low dose or a very high dose. So having something you can refer to is very important. And do not be afraid to refer to it, even when you're in the household. Do not be afraid to tell the man or the woman of the house, I want to look at the booklet just to be sure that I'm giving you the right information. Yeah. We are not God. We are allowed to forget and to refer. Tuko pamoja? And thank you so much for that. Deborah and Solomon, you have supported the county to make this happen. So, and moving on, and these two documents, strategy and the booklet, belong together. The strategy's own resource framework calls for a job aid in the hands of CHPs to be reviewed every year, and today we have made that become a reality. And for this county, it comes at the right time, Your Excellency. Nyeri's population is growing slowly, but growing older. Thank God, because of excellent medical care. High blood pressure, diabetes, and other silent diseases, especially cancer and mental health, are here with us, growing in leaps and bounds. And they often grow quietly, as we have heard. A person can feel well while the disease advances, but a confident, well-equipped community health promoter visiting a home and with the right information is able to help the household get the right screening or go for screening on a more regular basis, so that even these quiet diseases, they are picked before they become too complicated. If it is cancer, we pick it when it is stage 1 instead of picking it when it is stage 4. We believe this is what this booklet will help you, so that you're also helping us to be more screened on a more regular basis. I also commend Nyeri County, Your Excellency, and your entire team for its progress in adopting technology. At this point, we are working together with your team to develop tools, including artificial intelligence-powered tools that will help health workers track, especially non-communicable diseases like diabetes and high blood pressure more effectively. You know, data is very important. Whenever a community health worker, you have so much data and you need to make decisions, please refer a client to a doctor, and the doctor is looking at the patient with diabetes, but they can't remember what was the blood sugar last time or what was the blood pressure last time. So sometimes even as doctors, because you don't have the right data, you find that the patient is getting into kidney failure and we realize too late. We are building systems together with your support, Your Excellency, and your team to make it easier for doctors to have the right information to optimize care. And I know Solomon and Deborah have promised me that is happening. Through Project Thrive, Amref Health Africa has worked alongside the county government of Nyeri and Nakuru, and our part has been to support, helping the networks take shape, connecting the services, backing frontline health workers, deepening community engagement, and improving how data is guiding decisions. And that shared work has now, and this is a good news, my friends, this work that we have done for the last couple of years at the Project Thrive. A couple of months ago, our donors visited all the way from the US, and the Moderna Charitable Foundation has made this first phase possible. We thank them sincerely, and we must always recognize our donors. Moderna Charitable Foundation, remember that is with us. They are the ones who give us the money. We do not have it in a briefcase. But because of the work that you have done, a new United States Foundation has now committed to fund Project Thrive for another 3 years. That commitment honors the county's leadership, Your Excellency, and ownership, and the dedication of its health workers and the trust of its communities. It is also a chance to build on these days. I remember the last time they visited, the CEO of Amref USA called me and told me, Meshach, they were doing Just awesome work. You know the way Americans talk. Terrific. Just terrific work. Yeah? Yeah. So well done, team, because that's what's happening. But then I must say that after today, the test moves from paper to practice. And 3 things will matter most before I finish. First, let us make all the 8 networks work. The strategy should be gazetted and live in county plans, budgets, management, and performance reviews. I think that will be very important to operationalize it. The second one is to equip every one of the 2510 CHPs with a booklet. The booklet should reach each of them, and there should be orientation, not just providing the booklet, and I know we have planned for all that. There should be orientation, mentorship, and supportive supervision, and the basic supplies for the household visits. And the strategy itself adds what sustains this work: timely stipends, training, and working digital tools. So we must create an ecosystem that allows support for the CHPs, and I know we are working on that. And the third one, referrals, data, and community voice must grow stronger. And once again, thank you, Your Excellency, for giving the freedom of speech to these people, to your people. Information and feedback should move with the patient. Digital systems should keep care connected, and those are the tools you're working to build, building on what you have. And communities should meet often to shape and judge the services that they are receiving. So on behalf of AMREF Health Africa, I thank the county government of Nyeri and its leadership, Your Excellency, His Excellency the Governor, the trust, the openness, and the partnership that have made Project Thrive work. I thank the county technical teams, the Waziri and your entire team, the health workers, our dear community health promoters. I always say we love you because the work you do is so precious. Community health promoters and the communities who have shaped this work. Now these documents are yours. Let us make them work for us. The same way in church, or we have the Bible and we make it work for us. The true measure of today will not be these documents that His Excellency will unveil. It will be whether by 2029, several years later, the 8 networks will be working as one system because of the way we have financed them, and whether every community health promoter, each of you here, and the 2,500 of you spread across this great county, is well equipped to serve with confidence, the way as doctors we serve with confidence, and whether families across Nyeri County can enjoy better health, the way Francis and Margaret said it. We want that story repeated over and over again, and even problems being picked earlier. We're making it happen. Yeah. So before I finish, allow me to thank Nyeri County again for one more thing, and I must thank you, Your Excellency, for reading the evidence. The last time we were here with the board, and thank you for hosting our board, one of the issues that came up was we observed that Nyeri is doing very well on maternal health, but newborns are still dying in large numbers. Sometimes I think in Baridi, and all that. Yeah? And the charge came up, can you do a study? I want to thank you because your own teams, led by Dr. Nelson Mureu, have studied where and why young children are dying. And even they have studied the health of the community health promoters. They have even studied the prevalence of diabetes, high blood pressure among community health promoters, so that we start with the carer. So I want to thank you, Your Excellency, and your health team, because we are leading with evidence, because that's the evidence that will enable us to continue conquering the diseases that ravage us. AMREF Health Africa will work with you. So happy that we are now strong in Nyeri, and AMREF Health Africa will work with you from strategy to action, from guidance to daily practice. The way that example, the Buddha was here, that we will continue working with you. And as the AMREF team walking the road, in the room, please allow me, Your Excellency, if you can stand up so that I came from Nairobi, that we can appreciate it. Please stand up, everyone from AMREF. Yeah. Solomon Mwaneki leading the team, the Buddha there, and all the colleagues sitting there at the back. You may sit down. His Excellency has seen you. Thank you, colleagues, for the work you do every day. with the counties and with the communities. I think this is what brings a lot of meaning to even to my work and to our work and to the work of His Excellency every day. To know that you care and that we care. Asanteni sana and congratulations Nyeri County once again on these important milestones, and to every community health promoter here, and in the words printed in your own booklet, afya yetu jukumu letu, our health, our responsibility. And as I sit down, I give you greetings from your other son, Dr. Libidi Gitahi, who is our boss at Amref. He told me to pass my regards to you. Umezipokea? Thank you.
Thank you so much, Dr. Meshach Drangu and the entire Amref team. You are really true and special partners in this journey. Your Excellency, I want to confirm that we have already gazetted the 8 primary care networks. And therefore, this is the very, very tail end of their establishment. I want to take home for the community health promoters that this book, kindly use it also to educate the community. You should not use it in hiding. Make sure that it is your aid. It is also supposed to help that community member, that patient you are taking care of. And at the end of it all, from what I have heard, we will request you that even leave one booklet to that person. Because an educated person on their disease is an easier person to take care of. So thank you so much, Your Excellency. Kindly allow me to invite my colleague, Roslyn Mungai, the CEC in charge of health, Nakuru County, to make a few remarks.
Thank you very much. Thank you very much, Waziri Daktari. Your Excellency, the Governor, Nyeri County, Daktari Mwalimu, my colleague, Waziri wa Afya, Nyeri, Daktari Kirago, the leadership of Amref Health Africa, the county health leadership of Nyeri County, the community strategy team, distinguished guests, ladies and gentlemen, good afternoon. First, those human interest stories that were told here inspire us, Your Excellency. I was seated there next to Dr. Wanjiku and I told her, this is the reason why you went to study medicine. Yes. For people such as this. Please accept greetings from Governor Susan Kihika in Nakuru, Your Excellency. It is a great privilege to be in Nyeri County today alongside Dr. Susan Wanjiku, the chair of the Molo Primary Care Network multidisciplinary team, representing Nakuru County in this ongoing peer learning initiative. One of the distinguishing things about Nyeri and Nakuru is that both Dr. Wanjiku here, and she can stand up, and Dr. Wairimu here, your staff, went to Cuba to study family medicine. And they came back with such excellent capability. I've interacted with both of them. They teach us every day. Thank you for elevating them, because my teaching is that Cuba developed the model. We are implementing the model. So we are 100% behind the technical team in Nyeri, led by my colleague Waziri wa Afya. Allow me to thank His Excellency the Governor, the County Government of Nakuru, and Amref Health Africa for your leadership in creating and sustaining this structured peer learning partnership. For more than a year now, Nyeri and Nakuru counties have been learning together. This has not been a single exchange visit. It has been a deliberate, structured, and continuous process of sharing experiences, challenging ideas, testing innovations, and strengthening primary care networks collectively. That is a true value of peer learning. It is continuous, It is practical and it is built on trust. Most importantly, it enables counties to improve by learning from one another's experience. In Nakuru, Your Excellency, under the leadership of Her Excellency Governor Susan Kihika, we have made a deliberate and strategic choice. Primary healthcare is our future. We believe the future of healthcare will be built from the ground up through strong communities, represented here, functional dispensaries, responsive health centers, and well-coordinated primary care networks. For us and our 16 primary care networks, strengthening level 1, 2, and 3 is not merely another program. It is the strategy through which we are building a resilient health system capable of delivering universal health coverage. That is why our focus has been on building systems rather than just implementing projects. We have institutionalized the allocation of a defined proportion of healthcare resources to the primary level. We have developed comprehensive costed primary care network work plans financed through the Primary Health Care Fund, which you all know about, because we believe financing should strengthen systems, not just activities. We have also agreed that every partner-supported intervention, including those supported so heavily by AMREF Health Africa, must be embedded within our primary care networks. We do not want parallel programs. We want one county system, one county plan, one county vision, and every partner strengthening that vision. Whether it's mental health, maternal health, or child health, non-communicable diseases, immunization, or community health, our objective is the same: to make primary care networks the platform through which services are planned, delivered, monitored, and continuously improved. As we continue learning with Nyeri, our own thinking continues to evolve. Over the past year, we have observed Nyeri deliberately strengthening its primary care system. We have observed you develop clear strategies. We have observed you develop standard operating procedures, including the ones being launched today. We have watched you standardize implementation and create systems that depend less on individuals and more on institutional practice. We have also observed your commitment to protecting and prioritizing primary healthcare financing. These may appear to be ordinary management decisions, but they are the building blocks of extraordinary health systems. They are the lessons we continue to carry back to Nakuru. Not because we seek to replicate Nyeri, but because every strong system offers ideas that can be adopted, strengthened, and made our own. This is the strength of peer learning. As we continue this partnership, Your Excellency, my hope is that we formalize it into an even further through a structured community of practice between Nyeri and Nakuru. A platform where our primary care network teams continue meeting, continue reviewing progress, continue solving challenges together, and continue holding one another accountable for the strengthening of primary health care. Because health system transformation is not a competition between counties. When Nyeri succeeds, Nakuru learns. When Nakuru succeeds, Nyeri learns. And when counties continue learning together, Kenya's health system becomes stronger. On behalf of Governor Susan Kihika, Nakuru County, I thank His Excellency the Governor, AMREF Health Africa, and the people of Nyeri for your hospitality, always, your openness, and your leadership. We look forward to continuing this journey together as we build stronger primary care networks, stronger primary health care systems, and healthier communities. Thank you, and may God bless you.
Thank you so much, my colleague, CEC. Your Excellency, just before you came, Dr. Wajiko had given us a talk on the Cuban experience, and therefore we fully recognize her, and we are all versed with the Cuban picture that she came up with.
We need also to thank her that she came back.
Wow, thank you. Thank you so much.
I was really worried she would get a
So, thank you so much. And of course, she should be an example to others who may go out to still come back and serve your people. Your Excellency, in front of you, beyond the community health promoters, we have the CHMT so that His Excellency and see you kindly stand up if we're a CHMT member. Very good. Just wave to His Excellency. Asante sana. Then we have the medical superintendents, the ones who made it here. Dr. Kagwa, I can see you. That's Dr. Kagwa from Karatina and Beatrice from Ihororo. Wave to His Excellency. We have the sub-county health management team. Please stand up if you are allowed. This is the team, Your Excellency, that will drive this document directed to the community and make sure that the community benefits. So kindly wave to His Excellency the Governor. We have other partners. I can see the budget hub. Ametoka. Any other partner who is allowed, please don't feel left behind. Your Excellency, we also have members of the County Advisory Committee here who have already had an introductory lessons or training on what it takes to be at the help of the county. Kindly stand up so that they are from various departments. Thank you. Just wave to His Excellency the Governor. The team is bigger, Your Excellency, but these are the ones who managed to make it here. So without too much ado, allow me then to invite His Excellency the Deputy Governor to give his remarks.
Thank you, Dr. Karago. Your Excellency, the Governor of this great county of Nyeri, Dr. Marimutai Kaiga, the Director AMREF, our CCM, Dr. Karago, our Director Dr. Mureu, also observing all the protocols already established. Good afternoon. As Dr. Karago has said, my singular duty is to invite His Excellency to come and give his remark. But before I do that, Your Excellency, allow me to address some of two issues already mentioned. One of them mentioned by my friend, Mr. Kafada. Kafada, Your Excellency, mentioned about the reductions of money from KCB. And if the matter is not addressed, Mr. Kafada, after I leave this place, I'm going to call the manager again, KCB. Because I remember when you came to my office, I called the manager when you were seated in my office, and he said he's going to address that matter. If it's not addressed, Your Excellency, the matter is going to be addressed. The issue of reduction of 700 shillings, others 200 shillings is unfair. If it's not addressed, Mr. Kavala, I'm going to look at that. The other one has been mentioned by my friend here, Ann Duta, about CHPs, and my assurance, Ann is, I'll do better than what the governor is doing. I know, and that's what has been coming to my office. What are we going to do after His Excellency leaves the office? I asked her, what are you talking about? Are we going to get a good governor? And I normally ask her, are you not seeing a governor in front of you? Are you looking for a governor out there without experience, or you are looking for a governor with 4 years experience? I've addressed that. So when you're looking for a governor, let us look for a governor with experience, not a governor without experience. This one also addresses the issue raised by my friend somewhere, somebody called chapter 6. I want to assure you, chapter 6, Nelson, there will be no vacuum. I've been taught a lot by His Excellency the Governor for the last 4 years. And I think the education I've gotten from him will not go to waste. I'll do my best, as a good student always do, maybe to outshine the teacher. He has taught me well, and you know he's a PhD holder. I'm not there yet. I'm an accountant by profession, so I deal with figures. But I'll try also to match know he's a teacher, also a politician. Me, I'm an accountant, but I'm learning to be a politician, like him. So chapter 6, don't worry, there will be no vacuum. Nyeri will be left in good hands. So, having said all that, I request all of us to be upstanding as I invite His Excellency to give his remark. Your Excellency,
Thank you very much. I was thinking this is the center. So can I pray that you bring this podium here so that I can address everyone as I look at them. Thank you very much. Thank you very much, Deputy Governor, aspiring to be governor. Mimi naonea yule governor nakuja hapa huruma. The one coming to Nyeri, ninamuonea tu huruma. Ukitereza kidogo hao watu watakufurusha vibaya. Si ni kweli? So kindly be seated. Our Deputy Governor, David Waroe Kinanire. I also have Daktari Gedenji. Daktari Dirango. Gedenji is also one of us, Deborah. Waziri wetu, Waziri Kirago, and also Waziri from Nakuru is a women county. Nakuru control. Everybody there, every leader is a woman. Mulipata hiyo nguvu wapi? The governor, the MPs, the kila kitu, even yuko ni shida kabisa, lakini watapambana. Si kusema kuna shida, I just said ni shida kwa wanaume. Si ndio? The chair of our health committee at the county, officers who have come. I know I have my doctors here, I have all of us together, hamjambo. Allow me first to give 1 minute to a lady who used to beat me in class. I am just saying, I appointed her, but I must disclose, I am conflicted because she was my classmate in primary school, na alikuwa natushinda ile mbaya. Josephine would be number 1 hapo. Sasa sisi wengine tunangangania number 2, number 3 hapo. Lakini yeye akiwa number 1. Josephine Gaita is ambassador. She has served this country as an ambassador. And so when the opportunity came for the chair of health, I had no choice. I just said I want international experience in Nyeri County. And who else other than her who was beating me in class? So may I ask that she be given a microphone to say hi. We have this far the health fund has grown to almost 1.2 billion even after we appointed her. So let me allow her to say a word and then I will give my speech.
Your Excellency, the Governor of the Nyeri County, Mwalimu Mutai Kahiga, Your Excellency, the Deputy Governor, Waziri, Dr. Kirago from Amref, Dirango from Amref, Waziri from Nakuru, all other guests, ladies and gentlemen. I'm honored to stand in front of my former classmate, His Excellency the Governor, today, just to say hello and to express my thanks for this day, especially when I heard the testimonies of those people who stood today. Sometimes when we see you people in the communities with these uniforms, many of us don't even understand. But I can see the work you are doing. And thank you, Your Excellency, for what they have said, what you have done for them. Because everything is gauged from the leader, and you have led from the top. Am I wrong? You can hear the praises. And that's why we are so proud as the county of Nyeri. Because when we hear other issues in other countries about health, Nyeri, we don't have those issues. And that's why I'm so grateful that you gave me this chance to be the chair of the Health Services FAD Board. We have tried, especially somebody mentioned about commodities, and Dr. Kirago knows, we have tried with your guidance to ensure that hospitals have got what they want, drugs. So I'm honored, and I look forward to doing better for you and for the country of Nyeri, for the sake of the Wanjikos and those people out there who really need our services. You are special. Nobody should belittle you, because it is from the communities that the health issues is taken all the way up to level 6, and especially with the assistance of the governor. So I'm honored to say asanteni sana, and may God bless you as you continue doing that wonderful job that you are doing from the communities. And as we heard, somebody cared to go and see that sick person. Somebody cared to go and take the blood pressure of the old woman in my community there in Chaka. Someone cared to go and look for that child who was sick at night. God bless you, and may He add more strength for you to make sure that you can traverse all this county for the sake of Wanjikos of Nyeri County and for the betterment of our health, because as somebody said, a healthy nation is a wealthy. So let Nyeri County be wealthy in all aspects. God bless you, Governor. Thank you so much.
Thank you very much. Thank you very much, Ambassador. I really appreciate what you are doing for us and for our community. You have also worked for this country, and we have seen results. So, before I read this very technical story, let me speak from my heart. Very well? Number one, I'm really extremely proud of you. You are a wonderful team. Kenya is on strike today. Is Nyeri on strike? No. Very good. Thank you very much. That is number one. Even as I sleep, even as I wake up, I know I have a people who look beyond everything else, beyond the money, beyond the titles, beyond everything else, and they are focused on the people of Nyeri, because the accounting that is healthy to create wealth. Is that true? Yes. And this one, Daktari, has not come because of anything else. It is because our mantra in Nyeri is people first. People first. And I am very proud. I always say, I will go home as the poorest governor in Kenya, but I'll be the happiest because I have done the very best for my county. Unaelewana? And so, when I listen to you, na hii wasiwasi yenu, yet I know you have the capacity and the capability of ensuring mnataka nani kama governor. It is you. 2,510 of you times 10. Genadiri ametosha. What's that? 2,510 of you times 10. Huyu amekalia kiti na kukaa vizuri na kufanya yale mambo mnataka aendeleze. That is number one. Tunaelewana? So, I am very happy that you are able to make it here and to come so that we can launch these two key documents. That is the strategy 24-29. That is our roadmap. That is our compass. Where does it take us? What do we need? And I can tell you, it's not simple money. For the sake of the incoming governor, we need 600 million to implement that strategy. It's not easy. So we must focus, work around that, look for the money, and ensure that money goes to the right. Tunaelewana? Let me also tell the people from, my CHPs, the money from national government, does it come direct to them or is it sent to you for you to pay? It comes direct to you. And we are glad that because of the success of you CHPs, wakati tulikuwa tunangangana na nyinyi, nikikuja mlikuwa mnapata 500. True or not true? Si ndio? And we have moved even before President William Ruto came kuona vile tunafanya, we had already started moving because we recognize the good work you are doing. My only problem sasa, kwani CHP wangu ni nani? Hakuna mtu ananitembelea. Mimi niko household gani? Do they visit you? When makuka idagia wabijika na household. No, you see, it must be in the household. See, mimi umeniweka wapi? Among the wewe unamuona mimi nauliza. Sasa mimi sipimwi. So can you find out? Munatibu kila mtu isipokuwa mimi. Yes, because I must belong to one of the 10. Si ni kweli? And so when you are walking around there, number one, I know that even remember during COVID, these people were there for our people. They were out there fighting this battle for us, and therefore I am always extremely and you know, everywhere we meet we must have a gathering and speak together because you are key people. So let me tell this my deputy governor a secret. These people there is something that they taught us. I know Josephine will remember when we were learning about Wakagukua. It is called what? Eh? You remember that story? Yes. These people can mutate. Today they are CHPs. Find out where they are on Sunday. These people can mutate. Find out where they are on Tuesday. Every month, from Monday to Friday, these people are first CHPs. Schools, nyumba kumi. This is the political mechanism of Nyeri. Aya, niwe kaza kuhewa. So no, what hii hadithi mingi unaenda organize na watu. Sema I want to meet all the CHPs of Mukoroine. Kwenda kaa chini na hawa mpange mambo. Hii mambo inatembea. But everything is finished. 25-10 soldiers. Ground in Aguruma. May I also speak to my team at back there? Everyone working in the Department of Health, please stand. Everyone working. I know they are good. I know they are the others. May I say how extremely proud I am of you. I have 4,000 employees. I have 4,000 employees in different, departments. Around 1,800 are in health. And I am forever very grateful. I give the biggest chunk of my budget to these men so that they can ensure that even though we are struggling with wage bills, with other very many issues, we still are able to get around 3-point-something billion to come to you. Sit down. I want you to ensure, if not for anything else, that I am aware you are doing the best you can in the circumstances, even when there is a complaint, because there are people who complain. There are people who will wake up, politicians, and they say, there are hakuna dawa PGH, no we are not like a mulimo. You get my point? I am very happy with what you are doing. And even as we launch these 2 books, remember, you stand there as the foundation to ensure that this is a success. And therefore, even for the UHC, I see some of their representatives who are here. Remember, like we said, nyinyi mkae mkijua mambo yenu imeangaliwa. Wacha Kenya ipige nduru. Already your letters of appointment are ready with effect from 1st of July. Hii ingine tunafanya ni madrama tu ya kusaidia COG na watu wengine tuseme unaelewa? Sisi their letters are ready. Lakini nikajua nikiwapatia wataweka social media. Kiheka anze kukorogwa na wengine. So they already know we have translated your terms to from 1st of July to permanent and pensionable tukienda mbele. Tunaelewana? Barua tu nimeweka hapa to protect the rest of Kenya because the minute I give you the letter uweke social media, Narok hata hii mgomo itawekwa times 3. So let them sort themselves out and we will progress. Tunaelewana? I have asked Amref and my Dr. Mureu and the team, as much as we have now this one, and I'm not belittling our knowledge of English, nataka tufikiria hata vile utakuwa na kope mbili, moja ya Kiingereza na nyingine ya Kiswahili, na ikizidi hata kabisa ni hadi kwa Ginya na Gikuyu. Tunaelewana? Ndio unaweka moja ya Kiingereza hapo, ya Kiswahili hapa na ya Kikuyu hapa. Gaita nadu moga choma. Tunaelewana? Because you are doing a good job, believe you me, and it can be done. As the first county to launch this one, let us also ensure we use it as we have been told. Do not be ashamed to carry this. And one of the reasons I must say I'm a very successful governor is because I read a lot. Every Friday, between Friday and Saturday, I get a report detailed from every department. Weekend yangu nikipiga harambee 2-3, nikiwa hapo nasoma tu. Nasoma hii department wanaendelea hivi na correct hata grammar. Hata kama mtu unajua hawa kazi yao ni kuandikiwa alafu wanaguza kitu inaitwa forward button. Chip. Namuuliza maswali. Anaanza kusema namwambia please be reading your report. And that is every Friday since I became governor. Wewe unafikiria nimesoma nini? I can tell you now how many tablets of Panadol were there in PGH on this particular day. Niko na hiyo report. I just check. And this is what I also want you to do. By the way, do you know? This booklet inaonyesha hata vile mtoto anatakana kunyonyeshwa. Kumbe nilikuwa nafikiria ati kunyonya ni style hiyo tu. It is talking about how a child should, a baby, mama aweke matiti mzuri ndio mtoto anyonye na mtoto awekwe. Nilikuwa nafikiria ni kiunduzo tu. That you just tell mtoto kamata na ananyonya. This book is talking about it. That tells you I have also been reading this. And that is what I want you to do. And so, may I say thank you so much, Amref Kenya, for working with us, for being here with us. And your story and us is intertwined. There is no way we can speak about ourselves without Amref. You've walked the journey with us. If I have to walk back, even when COVID, ilikuwa imewakisha moto hapa Kenya hii, you struggled to get us ventilators and many other things. And that has been very, very key. May I also thank this team, especially the CHMT, hawa watu, because they have not let me down. Every other time that we have to do what we must do to meet the conditionalities of a donor, we have made it. Any deadline, ikisemekana we must have returns by this date, they are returned. And none of us has been taking that. So as we launch this one, as we become the first county to do this, it is just going, it will be a waste of our time, it just becomes a booklet. Like ile nyingine, unajua Kenya tuko na program, si hata jana mliona kuna program nyingine inaitwa 2060, na hata 2030 hatujui ilienda wapi. You know, in this country we have that big problem of waking up one morning, very big stories, but when you go to the ground, and that is why many times Nyeri is accused of not being loud enough. Hatupigi nduru. Like now we are the first. I know, kama ni wengine, if this was the first one, hata kungekuwa na inaitwa nini, caravan inazunguka Nyeri ikiambia watu, it doesn't matter. That it's not politics. Everything is not about politics. It's about the real things happening on the ground. And so, as we work together, as we go through this, we will look, even I was sharing with the Daktari that we need to ask ourselves why some of the challenges we have in Nyeri, like NCDs, are affecting us. We need a research to ask what has happened to us as a community that is not affecting the Luo or the Maasai, or even the Kalenjins. Here in Nyeri we are being told don't eat red meat. Maasai huko wanaambiwa rarua nyama sawa sawa. The Kalenjins are running all over Kenya. They are the number ones. Even now they are winning gold. Na wanakunywa maziwa na mursiki. Mimi ninaambiwa nikikunywa fermented milk inaleta acid. Do you understand? These are the questions I'm telling these people and researchers. Sit down, give us the way forward. Look at it, do the research and recommend. But if we walk back a few years ago, no konyua gwa moteta riu. Niregeta koigua handu murero munyo moteta. Meteo ere kugithindire guku. So those are the challenges we need to look into so that we are able to progress. I was looking at this document and I was thinking about you, the CHPs, the trauma you go through. Because every time, Dr. Dirango, I visit Ward 6 at PGH, it's called the male ward. Huko, hata tubes na catheter zetu zote zinapelekwa huko. Ukienda Ward 6, kila mtu wako na, every hole has a tube. Every man you find in that hospital wako na tube moja hapa, ingine wapi, ingine. So I ask myself, when I was quarreling with the nurses and the in charges, they told me, Governor, hapa unapiga kelele bure. Hawa watu ni kuletwa wanaletwa hapa. Men in Nyeri don't go to hospital. They have to be taken. And that is why we organized this camp in Mudhoaini, where we had about 1,000 men turning up. Na think about it, 1,000 who made it there, na hakuna mtu hakuwa na issue. Huyo asijui ni nini, huyo ni nini, huyo ni. And I was asking them, si mumekuwa nyumbani murete ile Jesu ashoke amuhoni yaganeke. Because they are not going to hospitals. Then you are the people who go to the homesteads. You find them there. Munawakuta huko. You advise them, you tell them to come to hospital. Do you think they come? It's a challenge. So, may I commit? And one of the things I want you to do, CHPs, wacha tucheze siasa kidogo. Every time we increase at our budgetary level, commodities, we are now doing, I think, 100 million. We've been doing, there was a time we were doing even 3, but we got the health fund to assist a little. Lakini every time we put 200 million, so that you can get what you are talking about. MCAs wanakata, wanaweka barabara na mataa. Anza kuwaambia nyinyi tunajua mnafanya hiyo. And because, si unanielewa? Si muko na hawa huko? Si hao ndio wanaendelea? So ukipata nafasi kama chairman, unasema na unajua MCA yako area. Na tare unenderenda kuga na tuthaithe MCA wito. Budget ile rathie gwekirwo. Yekerwo bilioni 200 matige kuruta cia dawa matwekerere bara. Ni turenda bara no ni kaba tukoro turi ahonu tutare na bara kana mugwenda bara muri arwaru. You get my point? Because for them a road is more viable politically. Anaweza simama na kusema hii barabara niliweka tukawa na governor, lakini when it gets to the health, you know, the commodities, dawa ziwe za kutosha, zikikatwa hizo anasema hakuna kura anapata. But I don't believe that is the truth. When people come to hospital like Margaret, like that young man who came here, and they don't get drugs, they don't get the necessary, it becomes a challenge. Tuko pamoja. So, Dr. Mureu and Kirago, as we launch this booklet, it is for you to fight. For this, even if you took the 600 million and split it into 5 years, you will see for this year alone we need almost 120 million. So we have to struggle from our resources, from donors, to ensure that this PCN is working. And you have already seen, this is the actual bottom up. Wacha hiyo ingine ya President Ruto. Hii ndio bottom up, ambao tunaanza tukikuja mpaka juu. Because at the end of the day, Some of us will see Daktari, Margaret and the other one. Saa ile tuna faili yetu tayari inaanza clearance huko heaven. Imetolewa department hii, inaenda department, ama hujui inafanywa clearance huko. The minute ukiingia 65, your file starts moving around in heaven. Inatolewa department hii, inapelekwa hii, clearance hapo, inarudishwa hapo, inasemekana hapana, go back where you started, ndio unaanza kusikia kaka miguu, si ni namna hiyo. But as we come all the way from the health center, from the dispensary, even from where you are, wewe mwenyewe, at that level, by the time we get to see hawa watu, you have been well managed. So, may I request that these two don't just become documents. They become life partners to you. Kwa hiyo bag yako hii kitu inakaa. Na wakati jioni mama umemaliza kila kitu, unasema like dole management ya diabetes. You read. Unaona? Oh, very good. Na usione aibu. I want to repeat this. Usione nini? Aibu kuambia yeye goja kidogo. Tareke dole gathina kau gaku haha. Yes, namwambia this one onoria turerwo ginya ne riu ndweno ni Biblia itu. Don't shy away from that. Take care and it will help us. Ladies and gentlemen, friends and colleagues, mine is to just say I am extremely proud that today we are going to officially launch the two documents to give you my total commitment to be the shepherd and guide towards the realization, full realization and value for these documents. Having said that, may I once again appreciate AMREF Africa for walking the journey with us. We can see the results of partnership, the accolades we keep getting as a county. Mara tunaambiwa sisi ndio tuko number 1 kwa hiyo, number 2 kwa hiyo, number ile. That is the very best. As you get back to Nakuru, I know we are working very, very closely together. Let us build on this foundation. I sometimes feel the pity when people ignore real issues and start working with non-issues. Like Nakuru now is known for nothing else except ati kuna hospitali fulani ilichukuliwa sijui kafanywa nini. Yet so much is happening on the ground. The Kuresois and the others, people who did not even have any medical facilities, they have been put there by the governor. Lakini, what do we focus on? Sijui memorial, sijui nini, you know, petty issues. So, may I wish you the very best. May I thank the department and every one of us for the hard work that has been put in. We all agree that this is not a one-day thing. And with all those very many remarks, may I now just say the following, that it is now my honor to walk with my team to that place so that we can launch the County Primary Care Network Strategy 2024-29 and of course the Community Health Promoters Job Aid Book. Thank you very much.
Thank you, Excellency. Let's appreciate His Excellency. Your Excellency, thank you. My request to Your Excellency, before you proceed there, I want, I'm requesting you, because we have the advisory committee that was appointed as per the Act. The Primary Healthcare Act is that they are to be appointed by the CC Health, who is the chair of that committee and the secretary. So, Your Excellency, I'm requesting for the members who are here that we invite them to the stage so that they can officially receive their letters. I will start with Lydia Kabira Karimi, who is from the Department of Agriculture. Tukaribisha Lydia. Your Excellency, kindly.
Very well, congratulations. Thank you very much.
To begin our Thank you, Excellency. Next is Miriam Mwaniki. Your Excellency, we are inviting this into this committee because when we're talking about primary health care, matters agriculture are key, matters finance are key, matters infrastructure are key. So let's appreciate her. Next is architect Dennis Maina. Dennis has been very, very supportive. He understands health very well because even as of this week, Your Excellency, we're having a meeting with this gentleman to refine the plan for Kiawara. Let's appreciate.
You are 3 days late. Kindly, but I see you today.
Thank you, Excellency. Next is Mishek Maganjo Muni. This is the Director Water. Let's appreciate Mishek as he comes.
Director Water, you came in late. I hope you are not going to continue with that title. Because they were doing performance contracting. Thank you very much.
So, Your Excellency, the other members are not in, but with your permission, we are going to then give them the letter. So, Your Excellency, allow me now to hand over the program to our MC so that he can take us to the next stage where we are going now to officially launch the document. MC.
Thank you very much. Let us appreciate everyone. We are ready. Are you ready for the launch? Yes. Tuko tayari? Yes. Give us power. Are we ready? Yes. We are ready to make some noise because the governor is going to launch for us. We are just requesting you to move towards our daktari unaitwa Amref. It's so beautiful. Tutembee wote. If you can't reach there, you can appreciate from where you are. And there we go. Are we ready now? Yes. There goes the governor. We are going to do a countdown. Tuko tayari? Let us start with 5, 4, 3, 2, 1. We are saying God is good. If you can't see from where you are seated, we are in the Republic of Kenya, County Government of Nyeri, together with Amref. Tunapiga picha ya waziri akipokea a copy ya our Bible. Makofi ya waziri. Governor is requesting tukuwe na team Amref wapigwe picha. Nakuru team be ready, Nyeri team be ready, PCN advisory committee be ready, CHPS representatives be ready, and all our beneficiaries musikae mbali. Kujeni tupigwe picha na governor as we launch. Background yetu. Thank you. After tumepiga hiyo, we are going to have Amref team. Pia wao wapigwe na governor wetu, His Excellency. Asanteni sana. Tunaweza ondoka so that we can create more space. Tukimaliza hiyo, tutaondoka to create more space to our partners. Thank you. Umeinua kitabu? Imechukuliwa. Asante, give them some space. Ndio tuweze kuasha in Amref team. Team yote ya Amref, we understand. Wako wote, all the way from Nakuru, Nairobi, the entire team. Amref team, asante sana as you take your seats. Ndio hiyo. I believe you are more than this. AMREF team. Oh, very nice. Yani His Excellency anatuonyesha vile tutaishika. Kama hukumbuki kuishika, just confirm with His Excellency. I love it when I see the Deputy Governor having the two, tunajua Nyeri is safe. After that we have Nyeri team. Are you ready, Nyeri team? Team ya Nyeri. Then from Nyeri team we are going to have PCA Advisory Committee. Sub-county, be ready. CHPS representatives. Beneficiaries wetu mahali wako waanze kuletwa because pia wao watapata nafasi ya kupigwa picha na governor. Make sure kitabu yako haijainama. You can confirm. Very nice. That is Nyeri team. PCN. Advisory Committee. Waingie. Thank you very much. Wanaambiwa ukiingia hapa unakuwa na kitabu mkononi. Yes. You must keep on smiling. Very nice. Balance. Beneficiaries. Naona wameanza kukaribia, wanafika. Yes. Karibuni.
Nakuru wako hapa
Nakuru team. Oh, they are ready. They are shining. Karibu sana. After the advisory, watu tupate Nakuru team. Tumeshukuru sana because umeona. Yeah, this is Nakuru team. Kwa via grand power. The small ones? Oh, okay. Hold the document. Naona CSA wa Nyeri bado nataka kuona ndani. What is inside? What is inside? Wanaiangalia sana kama unajua umetusto kusema unasoma the report. Watu wengi tunafinya ile watu tunasema forward. After that we have our beneficiaries. They are here. Let us appreciate them as they come. Watakaribia ni wapigwe picha pia na governor na hawa ndio beneficiaries. Kijana ambaye anahali thank you. Yeah, Itozoti is Madera, that is confirming. Nyeri County. Nimeanzia Madera to Muraya. Muraya to Kiri. Kiri to Mkoroni. And Nyeri County. Thank you very much. Tuwapigie makofi, tuwapigie makofi, tuwapigie makofi. His Excellency, the Governor, we are requesting you. Before you sit down, we have a cake.
I'm requesting the think tank.
The think tank.
Yes.
Wale wali create
So the PCS think tank that came up with the strategy. Come here.
Wako wapi waje?
Haya, wale think tank wakikuja, DJ unatupea muziki. Wewe unaanza mahali hapo tu. Think tank as they come. Stay from here. Wengi tumeona. Kibansi.
Dr. Manuel, where are you? Johnson, where are you?
Very nice. Kama nasema kila mtu asongewe. Just come kama ni kama he is a winner. A winner is a dream who never gives up. Kila mtu ako hapa. Kuna keki pia.
Okay.
I smile, confirm.
The others just join.
Yeah, wale tulikuwa at the far end. Join. Keep smiling. Yeye anaendelea tu ile na muziki. Ukiendelea kama na you smile. That's done. In the other team, there is another team over here. So tunachomkea hapa, then we have the last team. Wengine waje. Success has been fathers. We can perform success has been fathers. Aha. Wanaoingia. Ingia kwa kidogo. Bana tukucho. Wengine on this other side. Put your one hand up, you say. Aliata subiri ya. I now she got the booklet. With a smile. Cuban team, be ready. Daktari wa Cuba, where are you? Watu wa kule wote from Nakuru, from Nyeri County. Cuba, hawa ni madaktari. Kama umesema. Hawakukatalia huko Kila mtu anataka kuwa Cuba. Hawa ni madaktari wa Cuba na tulisikia kwa Cuba. Thank you. Thank you. We are requesting whether
she can tell you I want to.
It's my classmate. Very good. Welcome, Nyeri. Hapa tunakata keki just to count everything. Na tunasema hii keki yetu it has the books. Tunapeleka at the center on the red carpet. Thank you. Keki inapelekwa katikati, nakwambia leo ni ile siku Yaani gawa anataka kila kitu iwekwe. Cake, we share the cake. Wote kwa pamoja. And we have our cake matron. Karibu sana.
Actually, this is a milestone that we are starting from the visa pill and the pill injection to the homestead where we are going to celebrate and to sweeten the healthy community because of the toolkit. At the same time, we are going to have a strong structure at the community level to enable our community or Nyeri citizens to be healthy. So this is a sweetness that signifies what has happened, and it acts with a bank of sweetness. So our Excellency, we are asking you to have the cake for us and to share with us, we taste the sweetness of this day. CHP.
Bwana Kafala is here. And a lady, very nice. Are you ready? Let us all sing.
Because they are going to go hand in hand.
Allah.
Wow! I'm sweet.
Very nice. And here to His Excellency the Deputy Governor.
So, wapigie makofi. We have tested what we are going to taste in this booklet that we have just watched today. Daktari karibia Nakuru, taenda kusema Nakuru how sweet it was in Nyeri.
Yes, Amref team. Team kubwa.
Yes, ambassador will also taste because of fact they wakikitisha pesa kule mashinani. Ana prepare. Then Amref. Just come, Team Nakuru.
Thank you.
Thank you.
Yeah. Cuba doctor, kwani alienda wapi?
Team Amref.
Cuba. I'm so proud of you.
And the CSP General, come here. Dr. Moremi, you are not here. Dr. Mogua, and the Deborah.
Mogua.
We tested, only two of you are not here. Ako hapa, the champion, Rosaina.
And here comes the director, Patrick Bogwa.
One MOHs and the medicine. Come and taste. We are the people who are with the study. That is soup and MOHs. Please come. And because of the committee, please we need you to taste this cake.
Cake in
There's
the
no honor like being given a cake by the governor. Just come here. CHMT member, we need a few come taste this cake.
There goes Dr. Kagwa. Naendelea vile vile. Keki ni kubwa. Haya, keki ni kubwa tukipita.
We are celebrating the sweetness of the food document and the sheep. This cake. So when you are sorry, you feel the sweetness. That's how the sweetness will be at the community level. As we get the cake, be seated, give us the places and dance.
Very nice.
CHMT members, please come. Sub-committee.
Sub-committee. Tunaingia hapa, tunaenda tukitoka. Aha, tunaendelea vile vile.
Even the MC get a chance to speak. Yes, when we take now, we are going to leave His Excellency. So that we can have, let me have some sub-county team, some CHP, come and give the cake, please. For the rest of the month, they have been given by the governor. We want to leave him.
Asanteni.
Thank you.
We want to move on with the program. So, tukimaliza, Madam Josephine Madenge, be ready to move the programs. Thank you very much. Our cake matron, Madam Joyce. I can see Governor amegawilia kila mtu. Kama hujapata, we still have more na tutazileta mahali upo. In frame of time, tunaenda vile vile. After that, we are going to have the closing prayers from one of us, Dr. Kagwa. So Dr. Kagwa, be ready for the closing prayers. Then from there, we shall give you the directions. Thank you very much, His Excellency, the Governor.
Budget hub. Budget hub hapo hapo.